Hello, my name is Vinita Kulkarni. Today I will be giving my master topic presentation on skin cancer. Cancer itself has become a very important issue in the recent years. It is well known for ending many lives and it has affected many families. A CDC study states that while fewer people are dying from cancer annually, there is an increasing number of people being diagnosed with it. Many medical experts are also doing a lot of intensive research on the subject. As many of you probably know, there are many different types of cancers, including lung cancer and pancreatic cancer. Today, I will be discussing another well-known cancer called skin cancer, as I stated earlier. Skin cancer is said to be the most common form of cancer that is diagnosed in the country, and over 20% of Americans will have the disease in their lifetime. While it is common for people to have skin cancer at a young age, most develop the disease at around 50 to 60. Skin cancer is often classified into two categories, which are melanoma and NMSC, or non-melanoma skin cancer. First, let's look at NMSC. There are many different types of NMSC, but the most commonly discussed are BCC, or basal cell carcinoma, and SCC, or squamous cell carcinoma. Basal cell carcinoma is said to be the most common type of NMSC, especially in those of Caucasian descent. And according to a study from the International Journal of Molecular Sciences, it is associated with HH, or hedgehog signaling pathway genes. A gene called SHH binds to a receptor protein PTCH, which in turn creates a mutation in the protein SMO and then suppresses many genes in the HH pathway. Features of basal cell carcinoma are cystic or nodular, morphic or pigmented. They often resemble pimples or bumps and most likely are to appear on the head and neck region. BCC is treated mainly through medical procedures like cryotherapy or chemotherapy. Experts say that it is also best to treat the disease quickly by a medical professional since there are not many pharmaceutical treatments as of now. Squamous cell carcinoma, on the other hand, is said to be caused by a gene TP53, which increases the formation of the disease. SCC can also be linked to the gene CFOS, a receptor that causes the inflammation of the skin. Like BCC, SCC is also a common form of skin cancer, though BCC does occur more often. Unlike BCC, however, SCC is more likely to spread quickly all over the body, whereas BCC is much slower. SCC is also likely to happen in those who are not of Caucasian descent more often than BCC, though it happens more in those of Caucasian descent, like most other forms of skin cancer. Features of squamous cell carcinoma are very similar to features of basal cell carcinoma, though in SCC, most of the spots appear to be crustier. SCC also tends to occur in those with transplants. This form of cancer is often treated with a certain type of surgery called MOS, micrographic surgery, in which individual layers of cancer tissue are removed from the cell. Though it can also be treated through other medical procedures like those that are used for BCC as well. Now we will look at melanoma. Melanoma is the most dangerous form of skin cancer, and it is very likely to cause death. It also grows and spreads more quickly than non-melanoma skin cancer. This disease is associated with the genes CDKN2A and CDK4. Melanoma starts in the melanocytes, which are cells that store melanin, and then spread to other parts of the body. According to the National Cancer Institute's website, melanoma can be spotted if an existing mole looks different. Experts use a mnemonic called ABCD to determine if the mole is affected by melanoma or not. The A is for whether or not the mole is asymmetrical. The B is for border, or like if the border or outline of the mole is not normal. The C stands for color, and if the mole is a strange color like black or brown. The D is for diameter and whether the size of the mole has changed or become different. and E is for how the mole has evolved or changed over the few weeks and months. Melanoma is often treated through medical and surgical procedures, mostly targeted therapy, chemotherapy, and immunotherapy like other forms of skin cancer. However, if the cancer appears to be very deep in the skin, it is most likely untreatable. There are many risk factors for skin cancer. The most common, however, are genetics and ultraviolet radiation. The genetic risk factors for skin cancer include, as I stated earlier, having certain Caucasian features like pale skin, red or blonde hair, freckles and moles, and blue or green eyes. Skin cancer also happens through those with a family or genetic history of the disease. It is also likely to happen to people who are older, specifically those over 50, as I said in the beginning. Although people with these genetic factors are more likely to develop the disease, it can happen to almost anyone. Another major factor for skin cancer is UV radiation and how long or often a person is exposed to it. People in places like South Africa and Australia, for instance, are much more likely to get the disease since there is a lot more UV exposure in those places. Exposure to UV radiation can cause a lot of damage to DNA and the genetic code of the skin, which causes a tumor in the skin cells. UV radiation plays a big role in the development of skin cancer. There are three types of UVR or UV radiation, which include UVA, UVB, and UVC. UVA reaches the Earth's surface quickly and is not filtered by the ozone layer. UVB does not reach the skin or Earth's surface quickly since some of it is filtered by the ozone layer. UVC has to be completely absorbed by the ozone layer before hitting the Earth's surface, so it does not penetrate through the skin as easily as other forms of UV radiation. Though all these forms of UV radiation are dangerous, UVC is the most harmful, followed by UVB and UVA respectively. The impact on skin cancer from UVR can be traced back to genetic factors, mainly skin color. Since Caucasian people tend to have less melanin, they are more likely to have skin cancer. In the epidermis, there are two kinds of melanin called eumelanin and phosphomelananin. Darker-skinned people tend to have a greater amount of eumelanin, which tends to be more effective at deflecting UV light. Those born with lighter skin, on the other hand, tend to have more phosphomelananin, which is more weak at deflecting UV light. Many people often think that skin cancer happens from UVR through the sun, but it's also been discovered recently that it can also happen in tanning beds. Studies show that many people who have used tanning bed at a young age, under 25, later were diagnosed with BCC, SCC, or melanoma. Many people use tanning beds due to a common misconception that those with tanner skin are automatically healthier. While it is true that those with darker skin are at a lower risk of having skin cancer, this mainly applies to those who are born with darker skin. However, everyone regardless of skin color can try to prevent having skin cancer. Many people often think that skin cancer happens from UVR through the sun, but it's also been discovered recently that it can also happen in tanning beds. Studies show that many people who have used tanning bed at a young age, under 25, later were diagnosed with BCC, SCC, or melanoma. Many people use tanning beds due to a common misconception that those with tanner skin are automatically healthier. While it is true that those with darker skin are at a lower risk of having skin cancer, this mainly applies to those who are born with darker skin. However, everyone regardless of skin color can try to prevent having skin cancer. The best way to prevent skin cancer is to use sunscreen, as said by many medical experts. Since the sun provides vitamin D to people, it is often necessary to walk outside for long periods of time, and it's not really possible to avoid the sun. Sunscreen can protect all skin types by filtering UV radiation that comes from the sun and prevents UV particles from penetrating deep into the skin. It is also proven by many studies that the use of sunscreen has decreased people's chances of having BCC, SCC, and even melanoma. However, sunscreen has only been proven to block UVA radiation and UVB radiation. There have been many recent advancements in treating skin cancer. One of these advancements is stem cell-based therapy. Stem cancer cells are certain kind of cells that can differentiate into other cells, which in turn produce more tumors. They originate in the brain and then they transform into other cells and they reproduce in other parts of the body. Stem cell therapy aims to stop this. Researchers have tried to create antibiotics that could potentially prevent these stem cancer cells from growing and differentiating into different cells. Another advancement made in the treatment of skin cancer is photodynamic therapy, or PDT. This involves using a certain kind of drug to kill cancer cells while they are exposed to a certain wavelength of light. The drug is a photosynthesizer which goes into the body and absorbs a light from an LED to damage parts of the tumor, and then with the LED, the drug kills cancer cells. Overall, skin cancer is a very harmful disease, and it is important to avoid it as much as possible since treatments are very limited. It is important that people take care of themselves in the sun and heat, as well as limit the use of tanning beds since these are all the main sources of UV radiation, which are likely to give the disease. However, it is also important to know that there are more advancements that are being made and will continue to be made. This concludes my presentation. Thank you.